Today we're going to have a little overview of MR brain sequences. So I'm going to give you a little rundown of what kind of sequences you might see on a regular brain MRI, how you might be able to recognize them by characteristic features of those images, and what kind of pathologies you might be looking for on each of those individual images. To give you an overview, you kind of have two sort of basic ways you might image the brain. One is to do it without intravenous contrast material, and one is to do it with contrast material. When you do a non-contrast brain, you're typically going to do a basic set of sequences, and then if you do a contrast imaging, you're going to do all of those basic sequences plus some post-contrast imaging. Now, the key components of a non-contrast brain are diffusion imaging. You'll often do a sagittal T1, so that'll be your one kind of non-axial plane. Then you'll do axial flare or fluid attenuated immersion recovery imaging. So that's a T2 image with the water suppressed. An axial T2, you're going to have bright water. So it's going to be very good at seeing edema and other pathologies. They typically do an axial gradient or susceptibility weighted sequence to look for blood products or calcification. And then finally, you'll do an axial T1. If that's going to be in your post-contrast study, it'll be right before your contrast is given. Then, if you're going to go on to give contrast, you'll do everything from column A. Then you're going to add some post-contrast images. Now, those are going to be T1 images. You can either do them as a spin echo with thick slices, usually 3 or 5 millimeters, or you can do some gradient echo 3D images that are very good for creating reconstructions in all different planes. Frequently, you'll have both of those. So let's cut right to the chase here. We're going to start out by looking at some diffusion-weighted images. Here I've hung up the DWI or raw DWI images on the left and the ADC or the calculated values on the right. Now typically when you do diffusion weighted imaging, your raw diffusion are going to come through as a series of different values, and you're going to have the beginning or somewhere in the series you're going to have a set of images that have very bright water, and those are not your diffusion weighted images, so to speak. They're diffusion weighted images, but they've been given a B value of 0, so they're not weighted towards the diffusion of water at all. And what you're seeing is the underlying T2 properties of the tissue. You can see again, like water is very bright, the fluid within the orbits is very bright, and you can see that the fluid within the CSF within the ventricles is very bright. But this looks like a T2 weighted image, only the quality is not up to what you would normally see in a T2 weighted image. Here this patient just has a little bit of edema in the subcutaneous soft tissues, but the brain is normal, and so you see the white matter is dark, gray matter is bright. You see a normal gray-white differentiation, kind of normal gyration pattern, and this is your B1000, your B0. And you don't want to spend too much time looking at it, but it can be a nice tool to look for hemorrhage or blood products. But then you're going to get to a series of images where almost everything is dark except the brain parenchyma, and those are your true diffusion images, or your B1000 or long B value diffusion images. And in that, the tissue itself is going to be dark, but you don't have much surrounding signal from the skull base, from the bones. You're not going to see much of anything there. I'll just window this out so you can normally see it. You want to window it out where you don't see the air, where you don't really see that much from the surrounding tissue. And typically this can be a little bit grainy. You're not going to see that great of gray-white differentiation, but what you're looking for is any areas that are bright. Now, what you'll see is that any area where there's an interface, where there's air in the adjacent sinuses, you can definitely have these linear areas of abnormal diffusion, or where it's very bright. That's particularly around the skull base. You can kind of window it out a little bit so you can see it a little better. But those are not abnormal, especially around interfaces. That's just an artifact of the sequence. Anywhere where there's metal or calcium, it's going to be pretty sensitive to that. Here, as you come a little higher, you can see again some of the T2 properties of the tissue. Dark white matter, sort of slightly brighter gray matter. And here this is normal, so you're not seeing any areas of abnormal diffusion. So that's what a normal DWI is going to look like. Now, if you look to the right, what we have is the ADC, and I'm just going to link these so you can see them. And what you'll have is this is now calculated value where you take the B0 and the B1000, do a calculation to get a true measure of diffusion, and the tissue will be typically rather dark here. You're seeing the B0 on this side, and you typically will see any areas that are abnormal or have reduced diffusion will be dark on the ADC. Now, some key features you can use to tell you this is the ADC is one, you can tell it's a calculated image because it has kind of very noisy margins. That's where there's a lot of noise from the calculation. You can see that the CSF is bright. Again, the fluid within the vitreous of the eye is also going to be bright. And then typical measurements, if you want to take a measurement of fluid, a typical measurement for fluid is going to be something around 3,000, or depending on the units, it can be 3. So here you see the CSF, and this ventricle is around 3,090. So that's the ADC there, and that's how you can check to see that your ADC has appropriate values. So you want to use your ADC for troubleshooting. If you have an area that's bright on your DWI, so if you saw an area that you were wondering, like, is it for a stroke, or are there T2 effects coming through, or T2 shine through, then you can look to see if you can find it on the ADC, and true abnormalities typically are dark. For this portion, I've put up one of the classic types of images you're going to see in your non-contrast studies. This is a sagittal T1 weighted image. Now, what you'll see as you scroll through, this is one of the classic sort of views. It's a little bit challenging, especially for people just beginning in radiology, to see kind of what's going on the sagittal T1, so I'll try to give you an idea. The way you know you're looking at a T1 is the white matter is brighter than the gray matter. So take a look here. See, the gray matter is darker. That's the opposite of what you see on your T2 or your FLAIR images. You'll also find that CSF-filled structures are dark, as are the globes. As you get to the midline here, this is probably the single most important image on your sagittal T1 weighted image, because it gives you a nice overview of a lot of normal structures. Seeing those normal structures at a normal location tells you a lot about whether a study is normal. Here you can see the optic chiasm, catch a little bit of the optic tracts as they go here. Here you have the pituitary infundibulum. Here you have the pituitary itself, or the anterior pituitary. It's very normal to see in the posterior pituitary. You have T1 hyperintensity. That's the neurohypophysis, so that's T1 hypertense in normal patients. Here you've got the mammillary bodies, the midbrain, this is the tegmentum. Here you see the cerebral aqueduct with the midbrain tectum, the fourth ventricle here with its kind of characteristic shape, the fourth ventricular outflow tract, the cerebellum, the cerebellar vermis you have here. So you see that it's all normal. Here you have the corpus callosum. You see the components of the corpus callosum. You have the genu here, the body, and the splenium. This most anterior part is called the rostrum. Here you catch a little bit of the midline portions of the thalamus, or the massa intermedia. So you kind of get a good look at all of those structures. You get a good look at the veins here, so this is the straight sinus and sagittal sinus, and you get a good look at the upper cervical spinal cord, the cervical spine vertebral bodies. So you kind of get a really good idea that you're looking at a normal patient. So you're going to scroll through here, see if you see anything, but probably not spend a lot of time on it other than that midline image. That's where you want to spend most of your focus. On here, what you're going to see is I've hung up the FLAIR, or fluid attenuation aversion recovery, on the left, and I've hung up a T2 with fast saturation on the right. So we're going to go through those together. We'll start by looking at the FLAIR, which is on the left here. So as you scroll up, come up from the base, you kind of get into the posterior fossa here, and you see that these images look very similar. They have very similar contrast for the tissue itself. Our white matter is a little bit darker, gray matter is a little bit brighter, but you see on this image all of the fluid has been suppressed. So this sequence has a fluid inversion at the beginning, which suppresses water, and so anything that's close to water is going to be completely suppressed. So you see again the vitreous of the eye has been suppressed because it's very close to normal water properties. And this FLAIR weighted image is extremely effective for finding tissue pathology, so it's very good for you to see abnormalities in the white matter, abnormalities in the gray matter. And It's really good for seeing pathology because that fluid signal has been suppressed. Now, if you come up a little higher, so people are taught when they are first taught to do MR that if something is bright on an image, that it's a T2 weighted image. If fluid is dark, that it's a T1 weighted image. In brain, there's one caveat to that, and that's if you do FLAIR imaging, because here you see the CSF is dark. What you want to look at is the gray-white differentiation. So come to an area of the parenchyma. If your white matter is darker than your overlying gray matter, what you're looking at is a T2 weighted image, or predominantly T2, just because the fluid is suppressed. Here you see the same gray-white contrast on the pure T2 image over here. As you come higher, again, you're going to see like gray-white differentiation here towards the apex. And it's going to be exquisitely sensitive for seeing pathologies in the parenchyma. Now, if we come to our T2 on the right, we're going to see that it's very similar. Some advantages of the T2 are that you have a little bit less noise in the posterior fossa, so it can be a little bit better for seeing white matter lesions in the posterior fossa. It can be better at seeing tissue abnormalities in soft tissue. So here you actually have a little bit of soft tissue edema or anasarca here in this patient. This patient probably has a little bit of cellulitis or edema around their calvarium, but the brain parenchyma is normal. But you can see that all of essentially the same information is contained in the parenchyma itself. Here you can see the ventricles quite well. You can see blood vessels a little bit better than you can see them on FLAIR. And you can see any lesions that are in bone, for instance, a little bit better than you can see them on FLAIR. But these two sequences contain complementary information. Now here I've brought up another sequence on the left. This is your gradient echo T2 that I've put on the left. For your purposes of seeing the difference, I've left the regular spin echo T2 on the right. And what you'll immediately see are some differences of this is surrounding the bone. You see a lot more susceptibility effects. So you're seeing a lot of blooming around the bone tissue, anywhere where you have air or things that create susceptibility. So air, calcium, blood products are going to be dark on this. What a gradient echo image is a T2 weighted image that's obtained with a gradient pulse. It doesn't have a sort of correction for local field inhomogeneities, so you don't have that reversal pulse in the middle, so you don't get correction of those local heterogeneities, and that makes it very sensitive for blood products, air, and calcium, as I've already said. And as you scroll up, what you're going to see is the contrast. Again, is a T2, predominantly T2 contrast. The fluid is bright, the tissue is a little bit darker, but again, around these osseous structures, you're seeing a lot of artifact around the sinuses. Again, that's just because there's no correction for susceptibility. You see blood vessels because, again, they have hemosiderin and effluent blood, and it's going to be very sensitive to seeing abnormal blood products in the parenchyma. So it's nice to look for blood products or calcification in the parenchyma. But in general, the tissue contrast is very similar to your T2. You just have a little bit less sharpness of the parenchyma itself because you're not getting that correction, so you have a little bit more error within the signal itself. Now here I've pulled up the axial T1 weighted image on your left versus the FLAIR image on the right. I've just left the FLAIR image on the right because we're going to use that to contrast a little bit with the pre-contrast T1 that you have on the left. Now you can see in both of these sequences, as you scroll up, the CSF is dark. So that's not a perfect clue for what kind of image you're looking at. As you scroll up, what you're going to see, though, is that the contrast between gray and white matter is reversed. So on your T1 weighted image, your white matter is brighter than your gray matter. And here on the FLAIR image, your white matter is darker than your gray matter. That's the single most reliable way of telling the difference. And again, CSF doesn't really help you because they're both dark, but you can definitely see as you come up here, this white matter in the corona radiata and septimio valley here is pretty bright, and that's going to help you a lot in differentiating these. Now, your T1 pre-contrast image is good for a couple of things. One, it's good for identifying things that are intrinsically T1 bright. Calcium, blood products, melanin, It's very good at finding those things. It's also good to see if something is T1 bright prior to contrast administration, so you can't really call something contrast enhancing if it were T1 bright intrinsically. So you're going to look for any abnormalities here. So nice for picking up blood, as I said, nice for picking up calcium, and then nice to use as your comparison for your post-contrast. If you were doing only a non-contrast examination at this point, you would be done. However, this patient was going on to get contrast, so I'm going to show you now the post-contrast sequences. Here I've left the original pre-contrast T1 on the left, and I've put the post-contrast T1 on the right. Now this is a thicker slice of regular spin echo sequence for post-contrast. What you'll notice right off of the bat is some of the blood vessels, the epidural venous plexus near the foramen magnum here is bright, so that's gotten bright because of contrast. I do caution you a little bit about looking at blood vessels to tell if you have a post-contrast administration, though, because of flowing blood can be a little bit tricky. For example, you see the vertebral arteries here are dark, and that's because of the flowing blood in them. As you come a little higher, I will show you the #1 trick for determining if you're looking at a post-contrast image. Take a look at the nasal mucosa. Here you see the nasal mucosa are very bright on post-contrast, whereas they were dark on the pre-contrast. Similar for the pharyngeal soft tissues here. So you know that contrast was given. You can't always even trust the labels that the text put on the study, because even though they think they administered contrast, sometimes the IV can blow, sometimes you don't have any flow into the brain. So you want to be alert for that. Here, though, you do see that the blood vessels are a little bit brighter. You see these small veins and arteries on the surface of the brain are bright on your post-contrast imaging. Now, post-contrast imaging is really key to look for some specific pathologies, tumors, infection, active inflammatory lesions. So that's the kind of things you're looking for. Here, though, you can see all of these little dots on the surface of the brain are normal. Here you see a little bit of enhancement of the pituitary infundibulum. That is also normal. Here you see some of the veins are enhancing as you get a little higher. So in general, your post-contrast T1 is going to look exactly like your T1, only you're going to have filling of those blood-filled structures. Now, if you have a pathology in the white matter, for instance, and disruption of the blood-brain barrier, then you get leakage of contrast into that area, and that's what you're seeing on your post-contrast imaging if you have pathology. In this case, the patient's brain is pretty normal. There's really nothing abnormally enhancing that you're seeing here. But what you will note is you get near the top, you have the same gray-white differentiation that you have on your T1. So white matter slightly brighter than gray matter. So use that to help you differentiate them. For the final portion of our post-contrast exam, at some institutions, and depending on the magnets and how they're acquired, but they've become very common now, three-dimensional post-contrast images will be obtained. You can see what I've put up here is the 3D sagittal post-contrast images. Now what I'll point out to you, you'll see as I scroll through, I'm going kind of slowly, but the slices are very closely positioned together, often 1 millimeter or less. What this allows is it gives you very good sensitivity for very small lesions. What you will also note, though, is that there's a little bit more noise than you'll sometimes see on your regular 2D acquired images. So as you scroll through, you're getting a very detailed view of brain structures. You're going to have a little bit less contrast sensitivity than you do on your 2D images, but that's made up for by the very good spatial resolution. Now here again, we come to that midline image that we spent a little bit of time on T1. You can see all the vascular structures very nicely. The superior sagittal sinus here, the transverse sinuses. You see the pituitary as you can see normally. As we continue through, what you're just going to see is more of the same on the other sides. You should see good symmetry between the sides, and you shouldn't see any enhancing lesions. Now, what this is really excellent for is for looking for very small contrast enhancing lesions in the parenchyma. This is great for metastatic disease. The other thing that this sequence is great for is it can be easily reformatted into other planes. And what I have here on the right is just the axial reformat of these same images. So many times you're going to see those sent over. What you see here is a line showing us where we are in the images. again, compared to that 2D image, you've got very thinly spaced slices here. Very good for seeing small pathologies. Again, but you see a number of normally enhancing structures, a lot of blood vessels. The infundibulum, as we saw before, will enhance. And as you come up again, you see that gray weight differentiation maintains the same format for the T1, because this is a T1 weighted image. So you've got axial reformats of that, and then what you'll also typically have is a reformat into the final or third plane, which is the coronal plane. So here you see a coronal image. Coronal are parallel to the face, and you'll see that it's the same data. That's again been reformatted. Be a little bit cautious with that, because any artifact that you have on your original acquisition, the sagittal image is going to look the same on your coronal or axial reformats of that same thing. So don't look at it and think, oh, I see this artifact is on more than one sequence, it must be real. That's typically not the case. Here you see, you get a nice view of the basilar artery, bilateral PCAs there, and you get again a nice view of the pituitary, the anterior portions of the circle of Willis there. So you get a nice view of anatomy. This very thin resolution makes the views of anatomy excellent. So just to conclude, in summary, we've taken a look at the sequences that you have that are part of a routine non-contrast brain. We've talked a little bit about what you might use each one for. If you do a contrast-enhanced brain, you're going to do everything from a non-contrast brain, and then you do some post-contrast T1 images. We've seen what the spin echo thick slices look like, and then what the thin slices look like, and how you can reformat them to your advantage into other planes. Just want to say thanks for your attention today. If you are interested in other videos, please have a look at the rest of our channel, Learn Neuroradiology, or check out our website at learnneuroRadiology.com.